Pathologists with LSU Health are learning more about why COVID-19 can be deadly. As part of a study just released, they performed autopsies on 10 African-American people who died from the virus. And as they told Erica Ferrando, the findings provide new and critical information to help treat others.
Autopsies from some of the first people to die of COVID-19 in New Orleans are revealing why this virus can be deadly.
No one knew in these COVID patients that the clotting abnormalities would exist.
At University Medical Center, LSU health pathologists Dr. Richard Vanderhyde and Dr. Sharon Fox were part of a team to perform the first series of autopsies on 10 African Americans ages 44 to 78. They had underlying health conditions like obesity and diabetes.
It is the most severely affected demographic within the United States.
When looking at their lungs, they found hemorrhage and blood clots in the vessels.
So what does this tell us?
As opposed to being inflammation within the lung spaces, causing some of the respiratory difficulties in these patients, that became clear that blood clots and damage to the small blood vessels in the lungs were actually a major factor in causing the inability to get oxygen.
They now know this was a significant reason for their death.
Was it a surprise to see these?
Yeah, it was a surprise because, no one had really reported that yet. I mean, again, as I said, everybody knew about the respiratory issues, but no one really knew about this hemorrhage. And so it was very surprising.
Awareness of these clotting problems will help treatment plans for others.
I contacted the clinicians at the hospital and said, hey, we're seeing clotting here. These patients are different than what you might expect.
They can't say for sure why this happens, but the findings are a critical step in understanding and fighting the virus. In New Orleans, Erica Ferrando, Eyewitness News.
And while not included in the original study, autopsies in people who were not African American showed the same clotting issues. Now, these pathologists believe the results may be applicable to a broader demographic.